Good morning and welcome to JoyNews Interactive. I'm coming to you live from digital address GA0992539 in Kokomemla Accra, also on DSTV channel 421 and Go TV channel 144, on Facebook, Twitter and Instagram, also on YouTube, we're JoyNews on TV. For all your stories, you can go to myjoyonline.com. My name is Mapita Sibidi and this is JoyNews Interactive. Catch you after this. Welcome back. Now, Ghana has recorded 9 more deaths and 777 new cases of COVID-19 in a new data published by the Ghana Health Service for January 31, 2021. Now, it takes the country's active cases to 5,786 and a total death toll of 433. More people are dying from post-COVID complications, and recent studies by health experts reveal that some patients who recover from COVID-19 are reporting back to the hospitals with complications which are suspected to have been caused by the virus. From difficulty in breathing to general fatigue, the post-COVID complications are proving to be as fatal as more people are beginning to die after recovering from the virus. Now let's listen to Dr. Justice Youngson of the the General Secretary of the Ghana Medical Association, and also Kwame Sapong Asedio on the post-COVID-19 effects.
Now, what we have seen clearly is that post your recovery, like you described, you're testing negative, you're being discharged from the hospital and what have you, there are residual problems or complications that these patients will have to grapple with, especially those who get moderate, severe critical illness. And then even those with mild conditions who have been treated at home and all that, they also can get these problems post their recovery. And the problems cut across all organs. You may not have all, but you could have a combination. It could be 2, 3 different systems or organs involved. It could be just one for you. But the long and short of it is that post-COVID problems are there. Let me just mention a few of the things we see, and then we'll zoom in on why ED or erectile dysfunction in particular. You can have situations where these people will keep having the problems, and sometimes they've been described as the long haulers. For 100 days, for 6 months, they still have problems. So fatigue, things like muscle weakness, difficulty breathing, difficulty sleeping, hair loss, loss of smell, taste, problems with, say, their mobility, issues around, let's say, mental health, depression, anxiety, some neurocognitive, disorders. So somebody, for example, like the sort of things you may see in somebody with, say, dementia, those ones are described as neurocognitive. So maybe loss of memory, stuff like that. Their affect is affected. Some are beginning to get seizures and what have you. It's all because of the problems that COVID has created. And a lot of it is as a result of what we call the hyperinflammation that occurs when COVID-19 is at play. And that results in all these residual issues.
So any which way you look at the data, it points to just one thing. We have our health in our own hands. If you're a man, like I put on Facebook the other day and people were laughing, you've got a choice to make. The choice cannot be that dire. You either play Russian roulette with your life, risk getting seriously ill or dying, or if you don't, risk total impotency, or if you're lucky and you don't get that, risk infertility. If you are a man listening to me speak, and these options are put on the table, and you think they are options that you are prepared to gamble with, then you are not a real man, you are an idiot. And that is how I would want to leave it. Because I don't know how else I can put it. The options are there, but people are not listening. And the more the data points to more severe things, the more we say, oh, this has become a national security problem. Yes, it's always been a national security problem because the thing started by shutting down your country. It shut down your health system. It shut down your economy. It shut down your social life. Now it's shutting down your organs. So initially, it started shutting down everything around you to give you a warning. You didn't listen. Now it started shutting down things in you to give you a warning.
As they say, prevention is better than cure. Let's check out some of these prevention tips.
Hello everyone. As we know, COVID-19 is here with us, and there are many precautions that we are being advised to adhere to. One of such is the wearing of mask. Now, when you walk around, you see people wearing the mask the right way or the way they want to wear it. So today on Health and Vitality with me, Dr. Hannah-Lisa Tete, would like to go through the different kinds of masks and how to wear them the right way. So we have 3 different kinds of masks here, and today we're going to look at how to wear them very well and how to remove them the right way. So that when you see somebody not wearing it right, you can actually help the person wear it the right way. We have the N95, we have the surgical mask, and then we have the cloth mask. Now we know that this is the safest in terms of filtration, followed by the surgical mask and then the cloth mask. Before you touch any of the masks, you should start by practicing good hand hygiene. You should sanitize your hands, or you can use soap and water, but if you don't have soap and water around, sanitize your hand the right way, using the right technique, not forgetting your fingertips and all parts of your hand. And then now you come to your N95. So you take it out of the safe place in which you're keeping it, and then you put your hands where your fingertips are should be at where the nose would be. So this is how it should be, this way. Now make sure that the flaps are hanging loosely. So here's what we have. So the flaps are hanging loosely this way. Your fingertips are where the nose would be. That's the first thing you do. Then you put it on your nose, over your chin. Then you use one hand for one strap. Use it to pass over your head to the top of your head. So that's the first strap. Still holding it in place, you take the lower strap, pass it over your head to the back of your ears, below your ears, on your neck. Now when you're done, you need to ensure that it's fitting perfectly. So use your hands over the parts where your nose is, the bridge of your nose, to fit it tightly. In certain instances, you'd want to find out if there are leakages. So you can put your hand over here, exhale and inhale. And if there are leakages, then you can adjust using these straps. So let's say at the end of the day, you're done, or the mask gets moist or damp or wet, and you need to change it. Here's what you should do, or here's how you should go about it. First of all, you need to sanitize your hands. So make sure that you sanitize your hands the right way. So what you do is that you remove the lower strap first. So you bring it above your head, hold it in position. Then you remove the strap above your head, and then you're done. If you're not done with it, or if it's not wet or damp or moist, you put it in a transparent rubber, seal it, and then you're good to go. But if it's damp or wet or the day has ended, then you discard of it immediately. So that's it for the N95.